Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzo.
I'm Dr. Brad Weening.
And I'm Dr. Peter Ince.
Blood in your pee, also known as hematuria. Hematuria, we're going to be talking about hematuria with a urologist who's been kind enough to join us today to educate us on what's going on if you see blood in your urine.
Right, so it's a very, very common thing, and we break it down into two broad categories. Is it blood that's detected by your doctor on a test, a urine test that shows a little trace of blood, or is it blood that you actually see in the toilet? So those are the two big differences that we divide them up.
So hematuria, trace amounts of blood that
We call it microscopic.
microscopic, or blood that you can just see, frank blood.
Gross.
Sorry,
Hematuria.
frank, no disrespect, but it's frank blood when you can see it.
Gross hematuria.
Yeah.
Gross hematuria. All right, so what's the deal?
So, as we all know, whenever there's blood coming out of any orifice, you should get it checked. And it's no different with the urinary tract. So, if we're finding traces of blood, let's start with that.
Okay.
If your doctor does a urinalysis and finds a trace of blood, do not panic. It is normal to have a little bit of blood in the urine.
Okay.
So the first thing, if your doctor says there's a little trace of blood, you need a urine test called a urine microscopy
Okay.
to basically quantitate how much. So the standard is 0 to 2 red blood cells per high power field, and you only get that result on a urine microscopy test.
Right.
0 to 2 is normal. So I see so many patients referred where they say there's, on the urinalysis test, there's a trace of blood. When we actually measure it, it's normal.
Okay.
So if there's 3 or more red blood cells under the microscope, under the high power field, you may need more testing.
Do you ask for two separate specimens? I read that sometimes you need two different specimens.
It's always ideal, and common sense has to be used. So if you are doing the test during your period or you have a urinary tract infection, do not do the test at that time because there's obvious reasons why it's happening. They even say it shouldn't be done after a really heavy, if you just run a marathon or really heavy exercise, you shouldn't do a urinalysis because there will be a little bit more trace of blood.
Yep.
So on routine testing, on 2 occasions, if they find a higher trace of blood than normal, you may need more testing, and that's usually divided into age. So we use 40 as the cutoff. What we're looking for is there something bad going on, or is this just a normal occurrence?
When you say
That's
bad,
why
you mean like cancer,
We want to make
infection.
sure cancer's the big thing we want to rule out, or kidney disease.
Okay.
Okay, so you said it's the cutoff age is about 40. That means you.
Well, 40, if you have microscopic blood and you're 40 years or less, then what we usually recommend is let's do an ultrasound of the kidneys and the bladder and make sure there's nothing like a kidney stone or a little, could be a tumor,
Okay.
or anything else that can be picked up on the ultrasound. And a urine cytology can be done to look for abnormal cells. Now, if you're under 40 and otherwise healthy, then we'll just recommend ongoing monitoring on a yearly basis. So we don't want that trace of blood to increase. So
Okay.
if more and more blood is seen, it could be a sign that something is going on and it needs to be investigated further. Now, if you're over 40 and you have 3 or more red blood cells, you need an extra test called a cystoscopy,
Okay.
and that's to check the bladder for any little polyps, which is a type of bladder cancer that can be causing it. Now, bladder cancers can be very superficial, and like polyps in the colon, if they're found early, they can be easily cured and prevent cancer. So that's why these checks are done. The test from below to look into the bladder is called a cystoscopy, and then we also do the ultrasound or a CT scan to look at the upper tracts, the kidneys and the ureters.
But you're physically just looking at it with your eyes. So this is under heavy sedation or general anesthetic. Camera goes up, you look at the lining of the bladder and you say, hey, everything looks okay.
Wrong.
Wrong. Okay.
No sedation.
No sedation. Just
BW,
local
I'm
anesthetic.
sorry.
You haven't come in for your cysto.
So it's just local anesthetic? No
boy.
sedation.
Yeah, no, No, people who
I
are
would need
watching
some
this,
sedation.
people who are watching this, relax.
I would need some sedation.
People who are in
Relax.
the video,
I
relax.
spend most of my time trying to tell people that cystoscopy is a fairly innocuous test. Now, having said that, by that I mean it lasts about 2 minutes,
Yes, I know it's a quick
and we
test,
use
sure.
a lubrication with a bit of freezing. Now, having said that, it can still be quite painful for some people. For women, it's usually a piece of cake.
Right.
BW, do you want me to get you a chair?
Sure, that's right.
Okay.
For
My knees are
men,
weak.
it can be more uncomfortable. And having said that, I'm sure you're going to get comments about people saying, I am never
comment.
going to have that test again in my life.
Okay.
But
Leave a comment.
most men will say, you know what? Yeah, that stung, it hurt, but it took 2 minutes. I would not want a general anesthetic.
get to go
for
home
that.
right away,
And
lower
they
risk,
walk in,
for sure.
walk out.
Sure.
So it's
Walk
usually
in, limp out.
tolerated.
Fucking crawl.
Walk in and
Cry
walk
out.
out happy that they got checked.
Okay.
So do not lose so much sleep over this. We're not pulling a tooth.
Okay, fair enough. Fair enough. Okay, so now we've done the microscopic side. What about the gross side? Like when you have frank blood or bright red urine. This
Okay.
obviously is traumatic for people.
So for anybody with blood in the urine, you need the full workup
Okay.
because we have to make sure that there's nothing bad going on. Now, the other thing I want to add in is risk factors. So if you're under 40 and you're a smoker and you have microscopic blood, you should have a scope because smoking is by far the biggest risk factor for getting cancer of your bladder or even secondhand smoke.
Right.
And that doesn't mean you have to be a current smoker. I see many, many people in their 70s and 80s who quit smoking 40, 50 years
Wow.
ago, and they come in with bladder cancer. And it's much more prevalent in smokers, even remote smokers.
Okay.
So that's very important.
Another reason to quit smoking, people, please.
All right. So you've got frank hematuria or hematuria that you can see. You may or may not have a history of smoking, but now you're going to get worked up. And what does that workup look like? Obviously, we don't have to do or do we have to do a urinalysis to look for atypical cells?
Well, if you see blood and it's definitive, unless you've been eating beets, then the doctor may still check for traces of blood. But if it's been witnessed by the patient, then they need the workup, which includes the imaging of the kidneys and ureters, and then the cystoscopy to look from below.
Okay. Is it always cancer if you have frank hematuria?
No. And that's very important to know as well. Most of the time we do not find cancer.
Okay, there you go.
So in men, the most common cause we find is that it's from the little vessels, blood vessels on the edge of the prostate. So as the prostate gets a little bit bigger, the blood vessels on the edge of the prostate tend to rupture or burst a little bit more. They're what we call friable.
Okay.
So as the prostate contracts and opens, it's like a sphincter that the bladder empties through. Little blood vessels can pop, and especially men notice it after they've been doing heavy lifting or after a workout. They notice that there's some blood in the urine. So for men, little blood vessels on the prostate are the most common cause, or can be a kidney stone, could be a UTI that wasn't diagnosed. There's many different causes for that.
Okay, so that's kind of reassuring that it's not necessarily cancer, in fact, not likely cancer. So don't hold back on going to get it checked out if this is happening to you because you're afraid of what you might find.
It's
Go get it checked
same
out.
like as it goes with the colon, if there's blood in the toilet after a bowel movement, I mean, it's much more likely that it's hemorrhoids or something like that than cancer, but you don't want to take a chance.
Right.
Is there any association with BPH or benign prostatic hypertrophy? Because guaranteed there's going to be some men say, listen, I have BPH, I'm taking Flomax, am I at risk of getting blood in my urine?
Anybody who has enlarged prostate is at risk of getting that blood in the urine, but do not assume that's what it is.
Right.
Even if you're a non-smoker. So I've also had people who are non-smokers, very healthy, and we find bladder cancer. So it needs to be checked.
Okay.
Yeah, you said it best. Blood coming out of just about any orifice in the body needs to be checked out because blood's supposed to stay on the inside. If it's coming out, get it checked out.
Exactly.
All right, so we've got hematuria now. We've talked about microscopic. We've talked about gross hematuria that you can see. We've talked about getting that checked out with a urinalysis, looking at it under the microscope, and then the workup usually involves some kind of imaging and ultrasound and direct visualization with the camera going in and looking at the wall of the bladder. I want to talk a bit about treatment, but I guess it's kind of hard depending on what the cause is. But if we break it down real quick, let's say you were unfortunate in that you went in, they found a cancer, and the cancer could be either the bladder or the kidney. Is that the idea?
That's right. So if the bleeding's coming from a tumor in the kidney, that needs to be further assessed, and that could be treated usually surgically with laparoscopic surgery to do a partial or complete nephrectomy. If it's bladder cancer, now the word cancer, just like with prostate cancer, there's a range.
Sure.
So most of the time, in most people, these little polyps, which we unfortunately do call cancerous, they're low-grade superficial cancers, but they're just little polyps growing on the edge of the bladder. And if we get those early, just scrape them off. They're treated, and there is a risk of recurrence, so we have to do what's called surveillance cystoscopy to keep an eye on things. But there's very little risk of that progressing if you keep an eye on it.
So it can be curative. You don't use the word cure because of the risk of recurrence.
Yeah, because unfortunately, there's a very high risk of recurrence for these bladder polyps.
Okay.
We need to do surveillance, but if they're found at an early stage, which most of them turn out to be, then just resecting them is the treatment, and there's very little risk of spreading, but you have to keep on top of it.
Right.
Okay, and then if it is blood as a cause of renal colic or stones, then we deal with the stones to solve that problem.
Yep.
If it is the prostate getting friable, just
Usually,
watch it.
we just reassure people and say nothing to worry about.
Okay. So you're not going to know it's nothing to worry about until you get it checked out. So if you take anything home from this, if you see blood in your urine, please go get it checked out. And please do get your urine checked as your doctor suggests, which requires you to go see the doctor on your actual regular basis. Anything else to add to that, BW?
That's a great summary. I feel a lot more secure about hematuria for sure. And I think we provided information for people to empower themselves and go get investigated. We always say it. See your doctor regularly, whether it's for your eyes or for your colon or your bladder.
You know, today we actually have an empty slot in the cystoscopy suite.
Okay. So, unfortunately, I'm operating all day. Otherwise, I would love.
I'll do your case for you, Brad. You're
Yes,
good.
you will.
I'll
I
cover
will
you.
not be participating in that unless necessary. But if you like this video, please like it, subscribe to the channel. Leave some comments about your experiences with hematuria. And if you want Dr. Zalzal to get cystoscopy.
Wait a minute. Wait a minute.
Yeah, we can have like a little vote in here.
That's right, yeah.
Hold on
I
a
love
beat.
that.
Hold on a
I
beat.
love that. Pick it.
Listen, you are in charge of your own health, and as this video has shown you, you really are in charge of your own health. Go get that checked out if you're experiencing those signs or symptoms.
And thanks to Dr. Ince for joining us
And
again.
thanks these
Pete.
guys for their public service. You guys are great.
We'll see you next time.